Welcome to Complicating the Narrative, a podcast that takes on the challenging questions in public health by embracing complexity rather than avoiding it. I'm your host, Salma Abdallah. This episode is part of the Purple Public Health Project. Each month, the project takes on a question that public health needs to engage with more honestly. From what the field is actually for, to how we can handle disagreement while we push to improve the health of populations. The goal is to build a field that can hold real intellectual diversity and still do its job. This month's theme is trust, what it means, how it's lost, and what it takes to earn it back. My guest is Erin O'Malley, the Executive Director for the Coalition for Trust in Health and Science, a coalition of more than 90 organizations working to enhance the public trust in health and science. Erin brings nearly 2 decades of experience in health policy, advocacy, and cross-sectoral partnership. And she leads an organization that is grappling daily with the question at the heart of this month's work. How do institutions that have lost public confidence go about becoming trustworthy again? We talk about what the coalition does, what she's learned about the mechanics of trust building, and what she thinks the path forward looks like, including the practical question of how any of us can navigate an increasingly complex informational system. Erin, welcome to the podcast.
Thank you. It's a pleasure to be here with you today, Salma. Thank you so much for inviting me.
So I want to start just diving in because I know the topic of trust has been top of mind for a lot of my colleagues, for myself in public health, but also throughout academia and scientists and even my colleagues who work at the hospital. So just starting with giving the audience some perspective, what do you think of the status of trust in science and trust in health in the United States right now?
That is the million-dollar question. And to your point, regardless of where you sit across the health and science ecosystem, you're thinking about trust and trustworthiness. It is on your mind. For many, it is the foundation of why they wake up every day and engage with the public through health interventions, care delivery, etc. But today in America, we are seeing every single aspect of American life experiencing great declines in trust, whether it's institutions in the country, be it government, education, banking and finance, etc., media. Regardless of the poll that you look at, we are seeing deep declines in trust. That said, when you look across various sectors, the highest points of trust, depending on, which of the polls or surveys you're looking at, trust is highest, but still depressed in the context of health science and healthcare delivery. And so we have known for a long time that there are so many drivers of what is trust and trust in health, trust in science, trust in the doctors and nurses that you rely on a daily basis. And there are historical reasons why trust has eroded. There are actions that have been taken that have absolutely eroded trust. And we can't have this conversation today in 2026 without thinking about how the COVID pandemic influenced and continues to influence how the field of both health and science are impacted in the context of trust.
And as you said, it's actually very relevant. We have a paper coming out hopefully soon that shows exactly what you're saying. We looked at trust in different institutions, 7 institutions, including healthcare in 8 countries. And the U.S. that was end of 2024. So the numbers will likely be changing now. And I'm seeing other studies as well that are trying, or surveys are trying to look into levels of trust. But trust in all institutions were down, including trust in, if we think of society as a larger institution, trust in people in the country. Trust in science and scientists was the highest, but it was still at 42%. So it's just like high trust. And that was in the US. What was also interesting comparing US to other countries, and those were countries across the globe. So all the way from India to Nigeria to Turkey and Brazil. It's interesting because the US also had the lowest percentage of people who just had complete trust. So that was the lowest country that people just felt like they have complete trust in the different institutions. So that to me is interesting and also a bit worrying because at least the work I do in public health, it's highly dependent on having a high trust society because we're asking people to do things that they believe came from scientific approach. And what does that mean if that's not the case? So I really appreciate the work that you're doing with the Coalition for Trust in Health and Science. Can you tell us a bit about the organization and the coalition and what you're trying to achieve with it?
I have the great honor of leading the Coalition for Trust in Health and Science. We were founded back in 2023. Feels like decades ago at this point, given so many changes in the context of American life, but founded in 2023, coming out of COVID, and really out of the concern about the continuing declines in both trust, as well as the proliferation of misinformation and disinformation related to health and science. So early on, through the work of amazing luminaries in the field, our early convening committee, now our board, pulled together the idea that it was really radical at the time. Could the entire health and science ecosystem come together to tackle this problem? I am based here in Washington. My career to date was 20 years in doing health policy work in Washington, and it is hard to get various aspects of any sector to come together, to put aside all of the other potential areas of disagreement, policy areas where they're not seeing eye to eye. But very quickly, we got upwards of almost 100 national organizations to raise their hand and say, this problem is so unique and such a threat to our ability to innovate on the science side, to provide quality care on the delivery side, to activate public health as necessary, that we collectively must work together, that no one entity can go it alone. So we have the great pleasure of bringing together under our big tent scientific organizations, organizations that represent providers of various stripes, organizations that are looking at bioethics considerations, quality improvement. We have public health organizations at the table, and we are so pleased that we can round out our broad membership with that of patients and consumers as well. And that said, what those organizations look like are the trade associations, societies, nonprofits that represent professionals, patients, and consumers in each of those buckets. So we don't have any individual members, at least at this point. We're, as noted earlier, still a pretty young organization. And so we have this great opportunity to work through the national organizations to help them improve their trustworthiness and build on trust and center trust in all that they do. And then ultimately push our content and their learnings based on our content out to their individual respective memberships.
This is really interesting for me because I'm learning more about trust. It's a topic that I'm deeply interested in right now. And I think it is fascinating and very helpful that you try to distinguish between trust and trustworthiness, because trust is what we're seeing, but trustworthiness is what, at least my understanding, is what we're trying to gain trust. But what are the content that you provide for your members, and how do you build it, and what do you build it on?
Sure. So I think one of the best ways to think of us is we really are a curator as opposed to a content creator, especially being a small team and recognizing that there are islands of excellence across the country. And so how we work is mostly completely virtually. On a biweekly basis, we're pulling our members together to bring them experts from the field who are in those islands of excellence, who have done pilot studies on trustworthy actions and activities, how to be trustworthy, effective ways of helping people access evidence-based information, helping them understand what is mis and disinformation, how to spot it and not to take action on it. So that is on a biweekly basis. We have those great member-only conversations. Just last year, we started a training workshop series where it's a little bit more hands-on for a virtual experience of digging deep into tactics and actions for trust building. One thing I will say, and I think we'll talk a little bit more about this later, is there are so many levers to pull as it relates to building and keeping and maintaining trust and rebuilding trust. But one of the things we feel really strongly about is effective communication. Whether it's interpersonal communication, how trade associations, societies, and nonprofits engage with the public writ large. It is so unique in this moment. So we've been doing a lot of the educational content and those training workshops around communications. I have monthly work group meetings with our members where we have experts come in and educate on topics related to building trust and effective communication, but also we allow, as part of that time, networking opportunities. It's an opportunity for our members who might not always be in the room together, even though they're all under the umbrella of health and science, to compare notes, to share best practices, share challenges that they're finding in their work. Those
Yeah.
are the main big components. We do have a website. The public part of our website is really geared towards helping individuals navigate health and science information. You could almost call it health and science literacy related content. And then we have a member portal where we have all of our content on demand for members. Additional educational content is stored there as well.
Sorry, I'm going to be a nerd for a bit here just
Yes.
because I've been thinking more about this recently. And I'm increasingly wondering if using the term, I don't know if this came up as well, because I want to ask about what are the main challenges or the most common challenges your members come with to those discussions. The term misinformation. So I read an article by a philosopher, I think at Cambridge University, I could be wrong. And he made an argument that the term misinformation itself is unhelpful. It has some political connotations now. It seems like it puts you on one side or the other of an argument, but also it's a term that we had an existing term for it. Like if something is false, we call it false. Why do we use the term misinformation? Do you find it helpful? I've been thinking more about that argument as I lean into thinking like what are the things that I get to label as misinformation? Is it based on the science I do, or is it based on my values? And should I, based on my values, use my hat as a scientist to tell someone else what you're doing is misinformation? So I don't know if you've thought a bit about that in your work.
Oh, Salma, we have thought a lot about it.
Okay.
And I could go in many different directions here. I think I'll start by saying you're spot on. So last week, I had the pleasure of going to a hospital in Arizona to provide grand rounds training for their staff. And it was about how to effectively engage in trust-building communication with patients. And a significant component of that is what happens when a patient comes in and is believing and taking action on mis or disinformation. And in that grand rounds, I specifically paused to call out the question you posed here today, which is, do we even say the word? Do we call it misinformation? And the best practice at this point really is moving into other terms, synonyms, whether it's a falsehood, a rumor, a misunderstanding, because to your point, Salma, we're talking about a field, that of health and in particular science, that is ever evolving. The scientific process is one of curiosity, of trial and error, of the fact that what is true based on the science today can evolve and change tomorrow. We'll talk a little bit more about what that means in terms of how does our field build trust with the American people when the science is always evolving. But I so appreciate your remarks, especially thinking about, as a scientist, can I ever officially say, this is the one true accurate point? And the answer is yes. Certain things we know. The sky is blue most days without a big storm coming
There's gravity, hopefully. Yeah.
There's hopefully gravity.
Yeah.
Exactly. This element of nuance, of vulnerability and curiosity is something that we talk a lot about with our members. So yes, going back to your core question, misinformation is not the word of choice or that of disinformation as we educate the field about how to best engage with patients. And so I'll end this response with, we again think a lot about mis and disinformation. When we were originally formed, the idea was we would be the one voice out in front. We'd have the weight and backing of the representatives across the health and science field, and that the American people would say, oh, sure, the Coalition for Trust in Health and Science says this is a safe medical intervention, or this biomedical innovation is the right path forward. And realize that in and of itself is not a trustworthy action. To say, listen to us for the sake of listening to us, listen to the scientists, listen to the experts. And so we've really leaned into how do we, one, help people understand what is mis and disinformation, not explicitly saying this is accurate or not, but helping people understand what it is. And then two, trying to really have a conversation with people, recognizing that, going back to something we talked about a little bit earlier, public health in the context of a pandemic has one goal and obligation aligned very closely to their oath. And when the American people want something different, we need to be able to build common ground. And by just dismissing people's beliefs as mis and disinformation, we're losing the trust-winning battle.
And I guess we would be remiss here if we don't talk about the elephant in the room, which is political polarization is a big part of the conversation we're having today. I think that's very important in public health. We're seeing some figures from the Kaiser Foundation where it seems like I mean, across political affiliations, trust in public health is going down, but it's clearly going down at a much higher rate. I think, I don't remember the latest one, but I think during Biden administration, it was among Republicans compared to Democrats. So I think I really worry now we're going to live in a world where, depending on which political party you're in, if the other party is in office, you don't trust the CDC enough. So it becomes one of those things that are just dependent on, do you think this entity is politicized or not? So how do you manage that challenge?
So, Salma, I agree. And I think, part of this challenge is that we could insert education, finance, we can insert other sectors, other topics, and have the same conversation and debate. I think, unfortunately and uniquely, public health, health and science are so connected to the human experience and the ability to thrive, and not just thrive, but for the larger efforts of the country. To have a strong
Right.
democracy, we need a healthy population.
Yeah.
And you get good health through engaging in healthcare, in taking innovative new therapeutics and diagnostics to prolong life. And so, yes, we are in a very polarized moment. I'm reading the same statistics that you just cited. I
Yeah.
I struggle I struggle with this. And I think one of the only ways, and one of the ways that we think about it here within the context of the coalition, is just underscoring the importance of effective communication, and underscoring a big component of the work that we do and are gearing up to do more of is engagement with individuals, and helping our members get into communities. But even that community level listening is one angle. The one-on-one interpersonal communication is also so imperative. And so I applaud the work of the Purple Public Health Initiative. When I heard about it, I was so excited, because public health is not political. It shouldn't
Yeah.
be political. The provision of care should not be political. Scientific innovation should not be political. But today in America, it is.
So for us, at least the way we look at it, and because I work on social and economic policies and health outcomes, I actually think public health could be political, but it should never be partisan. I think that's the part I struggle with a lot of the policy. Like, public health could have an opinion about policy A versus policy B could be better for health outcomes. And how do we achieve that policy is part of politics. But I think the issue there would be if we just assume one political party or being partisan has the monopoly on then what needs to happen. And I'm really interested actually in the challenges that your members are reporting. I have to say, I think you have an upper hand in a lot of the conversations with, I wonder if you have different conversations with different members, because institutions that have direct relationships with patients might have a better relationship. At least that would be my perspective in trying to infuse that human interaction, maybe reduce polarization, compared to institutions that work maybe at a different level where they never have that day-to-day interactions. But I'm not sure if you're seeing something similar in the challenges that you're facing.
I think so. I think for our members, roughly speaking, almost every single one of our members, regardless of where they sit across the health and science ecosystem, have done their own polling. So I often, and in particular over the last year, have been hearing both anecdotally and seeing reports of the various aspects or parts of the health and science ecosystem researching their part of the world. So, for
Yeah.
example, how does the average American feel about biomedical research? Where should it take place? Who should be funding it? From a care delivery perspective, surveys on how do you feel about your local primary care? How do you feel about your physician? How do you feel about your local health system? So, our members are thinking a lot about this, of course, in the context of politics. Every single member has a different set of issues that they care about, all of them tied to public policy, whether it's at the local, state, or federal level. And so, yes, our members are each uniquely navigating this moment, and do appreciate the fact that they could come together under the big tent of the coalition to share stories, figure out how they can create sub initiatives to go out and address, a particular component, because our coalition is swimming in a really wide lane. Again, it's all things health, public health, and healthcare delivery. One of those three lanes alone would keep a large organization very busy for a long period of time. We're checking all three boxes.
I can only imagine. And I think this is also helpful for me, because it seems to me that what you're creating here is similar to something that you said earlier, where you started off thinking, well, we're going to be the one entity that the public comes to. And then you realize, oh, their contexts are so different. the work you want to do is so broad that you might want to have specific and unique approaches to it. So creating space for different members to try to figure out what works for them versus not seems to be a really good approach. That's what I'm also finding just from the literature from trust now. There is no one size fits all of what needs to be done in trust. Like almost impossible to say this is what you need to do to be trustworthy specifically in a moment. But also I was wondering if that's one lesson you learned. What are other lessons that you've learned since starting this organization or this coalition?
Oh, I think I've learned, again, really underscoring the model that we initially started with is one that just does not make sense and would not build trust and would not be that of trustworthiness. And so even our understanding of in this moment, recognizing that there is pushback against the quote unquote credentialed class, don't trust the experts is something that we're hearing from some of the highest platforms in this country today. And so this pushback on the experts, of which the vast majority of our membership are the representatives of, that has been really eye-opening and thinking through how do we effectively recognize that this moment means that we need new trusted messengers. It might not be best, for example, if we have a national health crisis today, to think that we can put a virologist on CNN this evening and everybody will go get vaccinated. Well, people are not consuming information from a handful of media outlets the way they did decades ago. Having an expert on, in some cases, is a great trusted messenger. For some audiences, it's not. So really, to your point, thinking about so many elements of the nuances of trust building and being trustworthy and recognizing, to me, I think the number one thing I've learned is that the old playbook is out the window, whether it's the playbook of how to communicate with the public, whether it's the playbook of who is the best trusted messenger, or even the playbook of we hold authority because we are experts, because we are, for example, public health experts who've done the academic research, who have battle scars from being in the field defending public health, or physicians who wake up every day wanting to help advance human life, protect humans, make them healthier, give them independence, have studied years to do that. Or even on the scientific research side, people who use their talents behind or sitting at a bench in a laboratory. It's been really hard for our field in this moment of pushback of the credentialed class and don't trust the experts when, unlike other sectors, insert finance as an example, the impetus for engaging in a career in public health science or healthcare delivery is that of trying to do better for the common good and for your fellow citizen. And so I think that is also why our field just feels so uniquely threatened at this time. And final idea for you. I have really appreciated the fact that, as noted earlier, we have brought together so many different aspects of the health and science ecosystem that they have happily come together. I was talking to a member yesterday, or maybe it was earlier this week, who had said, I so appreciate that in our virtual setting, people put aside their issues, they're candid, and they're working together to actually drive solutions. And so that was so meaningful to me, and it just made our work feel valued and coming full circle almost.
Oh, that's great. And I want to actually pull on a thread that you just said there, because I really appreciated all those lessons that you learned. And what I appreciate about them is that you're taking the entire ecosystem in mind. We're engaging with the world. We need to think about those are the credentials that we have, but also a lot of us, all of us, I would assume, actually, who wanted to get into healthcare, public health, the health and sciences field in general, are people who really wanted to improve the health of populations. That's basically it. Like, they just wanted to help people. And I appreciate that because it actually looks at the issue from a different, slightly different perspective from what we're doing here, or what I'm interested in, which is, this is happening. Trust is not trustworthiness. So I am mostly interested also in how do we create a public health field that is trustworthy. So we tend to look more into what do we need to do in public health to improve our trustworthiness. And I like what you said about us getting into this because we care about people. I actually worry sometimes that because we worry about people, we don't, at least for me, we are not introspective enough to figure out what is the science here versus what are my values. Because my values, I care a lot about people. Then the science here could be something that I push even further than I should. Just a quick example, I give this to my students in class all the time. I know the science on tobacco. When I was a physician, I had a lot of older people who would smoke. If they're valued, if someone is like, I work a very hard job during the day, I work in construction, the one thing that brings me joy at the end of the day is to smoke a cigarette. I don't know how to then deal with my values of I want to maximize your health versus their values of what they want to just find joy in. And how do I bring the science here? So what I'm trying to do, what we're trying to think about, like how do we get a public health into a space that acknowledges science might be certain at some times, but also sometimes our values might be different than the values of others that we're trying to engage with. And how do we make it less moralistic? I don't know if you have some thoughts on that.
Oh, I do. And I'm so glad that
Great.
you're centering value in this conversation, or
Great. Yeah.
values, I should say. Value in the context of health is a little different
Yeah.
connotation. But the centering of values is so interesting and I think imperative to this work. I think it's also reactive to the moment. If you think of, and I would challenge individuals who've been in the field for a very long time, was the centering of values always there? Or was it I took this oath to preserve human health? I took this oath and I am singularly focused on achieving that goal, regardless of if the patient wants to smoke a cigarette, if the patient decides I'm not wearing a mask during a public health crisis, et cetera, et cetera, et cetera. And so the centering of values is imperative. I think part of this work is the fact that, and we kind of had a thread of this earlier, the nuance of what is a trustworthy engagement from a healthcare system to the community looks different than what is the public health official's angle of trust and trustworthiness with that same community, let alone if you're a pharmacist in the community, if you are a molecular biologist in a lab participating in the community, educating the community. And so this work is very much a learning exercise. Part of why we've structured the content that we have for our members is this idea of constant learning and refinement. Even, for example, we do not dig deep into issues. I keep my work as issue agnostic as possible. But as you can imagine, vaccines are a significant topic that do have deep connectivity to trust in health and science. So we talk a lot about vaccines, and even thinking about individuals who might be vaccine hesitant or decline getting a vaccine, there's a lot of nuance there. An example would be, don't paint me as an anti-vaxxer. I am okay with every vaccine as long as there's no mRNA technology.
Yeah.
And that is an element of nuance. And when you actually engage with people, as opposed to stick them in boxes based on assumptions, label them for various reasons, you'd miss a lot of nuance. And so to summarize all of this, I think this long game of rebuilding, maintaining, building, constantly checking trust is one that requires intention and a constant learning, because even if, we master trust today, we get all of our polling numbers back to 100%. The American people absolutely trust health and science writ large, no questions asked. Something could change tomorrow that we can't foresee today, and we will have to start the exercise all over again. So, being responsive, being in the moment, and bringing it back to the beginning, centering values and that of the values of the individual or individuals you're engaging with are so imperative.
So, Erin, I really appreciate all of this. And I know we just talked about how things should be context specific. Very important not to have a simple answer to what needs to be done to address trust. But I'm going to ask you to do exactly that. So I'm going to ask you, I know you told me this is important and complex, but I'm going to ask you, how can we earn trust in practice? How can we earn trust for people who work directly with patients, but people like me also who work on a policy or city or state level or national level, and people who work in even larger, greater scale, or people who are virologists in a lab? What should we do to gain trust in practice?
So, Salma, that is a really great question. And I'm going to give you 3 specific answers. So, in one-to-one engagements, in particular, thinking about health practitioners with their patients, I'm not sure if you or the listeners have heard of the term motivational interviewing, but it's absolutely worth putting a pin in, thinking about, and learning. It is a great way to equalize both parties, whether it's the healthcare professional or the patient. It gives both agency in the conversation, it airs both perspectives. And so essentially what it looks like in a nutshell is before jumping into as a practitioner, as the expert, I'm going to tell you why you need to know something or take action. It starts with a question to your patient about that particular issue. What might you know about? Have you read about? Do you know or have any concerns about? Insert the issue.
Hmm.
Cancer treatments, clinical trials, vaccines, etc. Then, upon hearing the response from the patient, and this is the most critical part, the professional asks, "May I share with you my experience here?" Or asking permission to give the professional's perspective. That is an oversimplified example of what motivational interviewing looks like in practice, but it is, I think, one of the most handy tools in the toolkit for effective trust building communication. To the second part of your question about, what do individuals who are trying to influence public policy engage in larger public health and population health related conversations? I would say in this moment, recognizing that the old playbook of communication is not the one we need to be playing from. What
Hmm.
I mean in particular by that is not just killing them with kindness, but killing them with data. Let me tell you why this public health intervention, this scientific intervention is the way to go. Here's my booklet of data with deep, talking points. And, we don't live in a world where people are consuming information like that. So
Yeah.
thinking really crisply about how to convey nuanced, detailed scientific data in a way that compels people to act. And most likely, again, it's not going to be deep in the data and it'll probably be deep in stories. So storytelling, learning to tell your story is an imperative step and one that we're helping our members think through, especially on the science side. For many who've been trained in science, your audience is that of your peers, journals that you're trying to get your work published in. For many scientists, the ability to convey their story, why they're scientists, why they do what they do, what their dense research means in practice in human life, those are really great skills that I think will move us forward. And then the third, that really big level of how do we try to change and right course. One of the things that I've been thinking a lot about is how we help empower anybody who cares about driving evidence-based content into public dialogue is to encourage people to use their voice, whether you are an individual who cares about some aspect of science or health or public health. You don't need to be a professional. You don't need to be a scientist to defend science, or a public health practitioner to defend public health, or a doctor to defend medicine. In thinking through how I engage personally, for example, when I'm on social media. What am I liking? What am I sharing? Every single person is susceptible to and disinformation. Every single person, myself included, has shared it unknowingly, at least. And so at that larger scale, helping people to understand that we each play a role, even if it's really, really small, even thinking through as a consumer of information. How do I consume good quality information? How do I share it effectively? Do I pay for it? There's, a larger question of great content being behind paywalls. If those of us who care deeply about getting good content out to the public, out from behind a paywall, how do I as a consumer help drive that? May I share one of my favorite news
Of
statistics with
course.
you?
Yeah.
So, and this will probably stick with you. Mis and disinformation is
Hmm.
rarely, if ever, behind a paywall.
Oh, wow.
The creators of it want you to consume it.
Yeah.
They're hitting you with these messages in so many different ways, in so many different platforms. And what's really interesting is to take that a step further. There was an article in Popular Mechanics earlier this year, and the headline was something along the lines of scientist asked AI to write a summary about Neanderthals. It didn't do an accurate job because all of the good evidence-based content for that summary was behind a paywall. It was in peer-reviewed journals. And so the summary as generated by AI had a lot of inaccuracies. So again, you think of if misinformation is never behind a paywall, how do we help think through innovating? And that is a big question for medical and scientific journals. How is your good scientific content making it into AI algorithms, getting into the public's hands? So there's ample work to be done.
This was really incredible. Thank you, Erin. I really appreciate the 3 points, and I think they apply to almost all of us who are doing this work. Even the doctor can do the 3, or if someone who's public health as me, I can do the public health work, but also advocate for science and public health in my capacity as a person. So, Erin, I know we talked a bit about all the type of information people find online, and how do you then help or figure out what is the information that you should trust versus not. And as you said, both you and I think almost everyone has fallen victim at some point to some false information they saw online. So do you have any advice, or have you done any work on to try to help people really identify what information is helpful or accurate and what information is not?
We have. So we have a checklist on our website. It's in a consumer toolkit about helping consumers understand where to go for good information, what types of websites make sense, what don't, checklists related to kicking the tires on content. But what I think is really helpful for people to think about, and this applies to any part of your life, not just consuming health-related or science-related information. In particular, misinformation and disinformation are designed to elicit emotion. So when you see a TikTok video, when you read something, when you open the email your uncle sent you, having forwarded a long chain of information, and you're consuming information and you get a gut reaction, and that reaction could be a laugh, a giggle, it could be fear, it could be outrage or tribalism, curiosity. When you consume something and your brain and gut is eliciting an emotion, that is a really great signal to pause. You probably want to do some more information, especially before you like the video, share the video, forward the email. Again, misinformation and disinformation are purposely designed to get some sort of emotion, because it is that emotional connection that embeds itself in the human brain and makes mis and disinformation sticky.
And where can people find this? Is it online?
Yes. So on our website, we have a list of resources, and they're divided into various categories, and it's under the Health tab under Resources.
Excellent. Thank you so much, Erin. It's been a pleasure having you today.
Thank you so much.
This episode was edited by Catalina Melendez-Contreras, with marketing and outreach by Kinkini Bahaduri. The podcast is supported by the School of Public Health and the Frick Initiative at Washington University in St. Louis. You can find Complicating the Narrative wherever you get your podcast, and you can also watch the episodes on YouTube. If you found this conversation useful, rating, sharing, or recommending the podcast is one of the best ways to help us reach more people. Thank you for listening.